Hi, everyone. This is Davina Ray, and you are listening to me only on Radio Nyra on 99.9 FM HD4, 101.9 FM, and 1490 AM. Today, I have a very special guest with me who actually needs no introduction. It's Dr. Vinod Jindal from the NCIAP. Dr. Jindal is a board certified ophthalmologist. He has many accolades to his name. He is also a fellow of the American College of Surgeons, a fellow of the American Academy of Ophthalmology, and the list goes on and on. So let's get to it and start this interview and learn more about Dr. Jindal himself. Welcome to the show, Dr. Jindal. How are you today? Let's start with a little bit about yourself and the beginnings of NCIAP.
Thank you so much, Davina. This is a nice introduction. And thanks to Radio Nyra for giving this opportunity to speak about NCIAP and our nonprofit clinic. So as you told, like I'm a practicing ophthalmologist in the area and retina specialist. But as far as this clinic is concerned, we are a group of physicians and local community organizers. We made this group, and I'm thankful to them, came up with this idea of a non-for-profit clinic, and which is for uninsured, underserved, and for everyone who creating a hassle-free health clinic.
Okay, that's very good to know. And how is this clinic different from other nonprofit clinics in the area?
So there are multiple nonprofit clinics, which are most of them are with a federal grants or state grants. So with a lot of restrictions, and not everyone can use them. There's like those are free clinics. Actually, thankful to them to doing that. But there's a big backlog overflown with the patients, as well as like a financial restriction. Certain people only can have that facility. Okay. And whereas in our platform, we have no restrictions, and we need only one ID, and just patient can come and we can see that.
Okay. So what is the charge per visit?
So we have like we started with 45, but now at present with the demand, we are now doing a $55 visit, which covers like main primary care. Any patient comes, they have like taken care of most of it, the basic examination. So to answer to your question is $55. Yes.
Okay. Okay. So what kind of tests are covered in this $55 in the initial visit, or is there anything else extra?
So this is like a consultation, like an initial consultation where we assess the patient clinically. If we need any further lab testing or EKG, there's a very, very nominal fee in that. Like, for example, there's basic panel, which is in the range of $10 to $15, including EKG, which is like outside that can go anywhere $100 to $150 to $200.
Oh, wow. Yeah,
in addition,
that is very good value, of course. You won't get that in many places. And what if a patient needs a specialist?
A very good question. There's a very, very important, we did try that if we can create some local in-clinic, some specialties, but this was very difficult. Those things are so specialized with the multiple instrumentation. So we have come up with a good network with the local physicians, thanks to all the specialists. So now, like they do give a courtesy and a subsidized rates for the patients referred from the NCIAP. So, for example, like myself, ophthalmologist, any patient comes to me related to eyes, and we do give a courtesy rate, and sometimes we let it go as needed.
Mm-hmm. Mm-hmm. And what if a person has an emergency suddenly? How does NCIAP deal with emergencies?
This is like an emergency thing is dealt regularly, just like any other clinic. We are available 24 hours to give an answer if we can handle via phone or otherwise to be seen. But there are some problems which have to go emergency room.
Mm-hmm.
So then that's what is recommended at that time.
Mm-hmm.
So they, depending upon the like condition, so either we use emergency room, but most of the urgent care needs we can cover in our clinics.
Mm-hmm. So does this place have a relationship with other hospitals, and does it have, do you liaise with other places? Do you have any partnerships?
Yes, basically it's not like exactly like a partnership, but we help them a lot. So like how this structure works, Davina, is in generally what happens, patients go to emergency room and when the hospitals have to take care of them. And once the follow-up care, there is not like they don't have a place where to go for a follow-up, especially if they are not insured and not
Right.
many doctors will be taking. So in that case, like from WakeMed, from Brett's Hospital, from those emergency rooms, we do get a lot of patients where we cover them as a follow-up visits.
Okay.
So,
Okay. So what message would you like to give the wider community? I mean, it's such a great resource here that many people may not even know exists in our local community here. So what would you tell young doctors who are coming up and the community to support you better?
so basically, starting from the young doctors who are coming up, like I said, there are like multiple of them. They're very, very receptive of this our program, and they do want to volunteer and work in this clinic so that they can uh, in they can feel good by helping the people who are in need, as well as the local community. I just want to convey them that this is working from their funds. They're helping us, and raising funds for this is helping the community. And I proudly want to say that this is the first thing by Indian community for whole local communities, a
Wow.
nonprofit clinic created. And with all their help, we have started now second clinic in, so which is and after completion of 10 years of our service at the first clinic in Raleigh.
Right. And where did you say the second clinic is?
Oh, second clinic is in Apex, which is
Apex. Okay.
closer to Cary and Morrisville, so that
Yes.
we can cover a lot of people in that area. Uh, from the Apex is at intersection of 55 and 64, the
Yes.
Apex Medical Park.
Right, right. So this is something for us to be very proud of, that you and many other founders and supporters and sponsors have created in our community. And thank you for joining us today and taking time out of your busy schedule. Somewhere I read you're famous for performing more than 30,000 procedures, actually. It says that on your bio. So thank you very much for coming on the show and, helping us get your word out also.
I really, really appreciate Radio Nyra and Davina yourself, and giving me this chance to speak to. And while leaving, I want to thank my whole board, our practice administrator, all volunteers, physicians, and organizers, and all the our great sponsors without whom we cannot complete this task which we and mission, and we appreciate that, and would we like to thank everyone.
Thank you. Appreciate your
Thank you
time.
so much.
Yes, sir.